Well, did you ever feel this situation and you said to yourself, this seems reasonable, this seems convenient, this seems like the smart option for someone my age? You are sitting at your kitchen table, maybe with a cup of coffee that has already gone lukewarm, maybe after sorting mail, medical statements, and a few grocery coupons, and you see a Medicare Advantage advertisement promising low premiums, extra benefits, and peace of mind. It feels helpful. It feels modern. It feels like someone finally designed something with you in mind instead of rushing you or talking over you. The words are calm. The smiling faces look familiar. The message sounds reassuring, almost personal. Most people stop thinking right there, and honestly, that reaction makes sense. But stay with me, because this is where it gets interesting. Beneath what feels like simplicity, there are layers that many seniors never notice until it quietly affects their health, their savings, or their stress levels. And here's the part most people never say out loud. When something sounds easy, especially in healthcare, it is usually because the complicated parts are hidden deeper in the paperwork. You do not see them in the commercial, you do not hear them in the quick phone call. They show up later, often when you are tired, unwell, or already dealing with something serious. Picture this. You think you made a responsible choice. You told your family you handled it. Then, months later, a bill arrives that does not look familiar, or a doctor you trust suddenly is no longer available, or you are told you need approval before care you assumed was routine. That moment of confusion, that quiet pause where you think, did I miss something? That is exactly what I want to help you avoid. Before we go any further, like and subscribe so I can continue sharing information most seniors are quietly dealing with every day. And bear with me until the end, because I will walk you through a practical checklist you can mentally carry with you anytime someone mentions Medicare Advantage. Not to scare you, not to overwhelm you, but to help you slow the moment down, ask better questions, and stay in control. This is important. My name is Judith Carver, and I focus on senior protection education. Before we begin, this video is for educational purposes only. I am not a lawyer, and laws can vary by state. My goal is to explain this calmly so you can make informed decisions. I help older Americans recognize patterns, understand paperwork, and avoid costly surprises. Dignity, clarity, and patience matter, especially later in life. And remember this, our rights do not expire with age. Let us start with the first reality most people never notice. Medicare Advantage plans are offered by private insurance companies. That one sentence changes everything, yet it is often overlooked. Private companies operate under contracts, business decisions, and yearly renewals. That means the rules, the networks, and even the costs can change from one year to the next, sometimes with very little warning. On paper, nothing feels urgent. In real life, those changes can land at the worst possible moment. A senior named Robert believed he made a careful choice. He checked that his primary doctor and his cardiologist were covered. He felt responsible. He felt settled. He told his daughter he had it handled. Then the new plan year started. A letter arrived that looked routine. Buried in the wording was a change in the provider network. His cardiologist, the doctor who knew his history, his medications, and his risks, was no longer in the network. Suddenly, Robert faced a decision he never expected to make. What followed was more than irritation. It was confusion, hesitation, and a quiet sense of being off balance. Do I switch doctors? Do I pay more? Do I delay care? These questions carry weight, especially when your health is involved. And here's the part that matters. Many seniors blame themselves in moments like this, even though the change was never fully in their control. Here is the reality. Stability is not promised, and understanding that early allows you to plan, ask sharper questions, and protect yourself before a simple enrollment turns into an unexpected disruption. Here is where it gets surprising. Many plans advertise low or even zero monthly premiums. That sounds comforting, especially on a fixed income. But premiums are only one piece. A woman named Elaine needed outpatient surgery. Her copay was far higher than she expected. What she felt first was disbelief, followed closely by anxiety. The lesson here is simple. Costs often appear later, and they do not always announce themselves up front. Most people never notice this. Medicare Advantage often requires prior authorization for services, which means you or your doctor must get approval from the plan before care will be covered, especially for higher cost services like skilled nursing facility stays, certain drugs, and specialty care. In fact, virtually all Medicare Advantage enrollees are in plans that require prior authorization for at least some services, and emergency services are one of the few exceptions where prior authorization cannot be applied. Let us break that down in real terms. A retired teacher named Harold had a bad fall, and his doctor said he needed several weeks of physical therapy. But his Medicare Advantage plan required prior authorization first. Weeks went by while paperwork shuffled back and forth. Pain increased, sleep was disrupted, stress piled on top of recovery. And here is the detail many seniors never hear. Even when a doctor recommends care, the insurer still decides whether it meets their definition of medically necessary. When that decision goes the other way, coverage can be denied. That is why delays can feel just as damaging as a refusal. Now, watch out for this pattern. Emergency care is covered anywhere in the United States, even outside your plan's service area, without prior authorization. But follow-up care often is not. A senior named Martha traveled to visit her grandchildren in another state. She slipped on ice and went to the emergency room. The ER visit was covered. Federal rules protect that. However, the follow-up specialist visit after the ER was not covered at the same cost because the doctor was out of network. The bills came and the stress followed. Unexpected charges leave many older adults feeling blindsided, even after they did what they believed was right. Here is the part few people explain. Your coverage can change dramatically based on where you are and who you see. Emergency care offers real protection, but out-of-network follow-up care without the right approvals can still cost you even when everything started as an emergency. And these rules vary by plan type, travel benefits, and how the service area is defined. Here's what to remember. A delay can quietly turn into a denial, and emergency coverage alone does not guarantee protection from follow-up costs. Pause for a moment. Dental, vision, and hearing benefits are heavily promoted. They sound generous, but limits apply. A man named Thomas needed extensive dental work. His plan covered a small portion. The rest came out of his pocket. What settled in was disappointment. The takeaway is simple. Extras almost always come with boundaries. Stay with me. Prescription drug coverage can vary widely. Formularies change. A medication that is affordable one year may not be the next. A woman named Carol stood at the pharmacy counter, facing a higher cost. Embarrassment and worry followed. This is the part few people talk about. Consistency matters when it comes to medication. Here is another detail that often goes unnoticed. Out-of-pocket maximums reset every year. That means costs can repeat. A senior recovering from cancer treatment reached the maximum one year, then faced it again the next. The exhaustion was not only physical. The reminder here is financial relief may not last as long as you expect. Do not let them rush you. Marketing calls and mailers are designed to create urgency. A widower named James felt pressured to enroll quickly. He did not compare plans. Regret showed up months later. What lingered was self-blame. The truth is simple. Time protects you. Here's a quieter risk. Switching back to original Medicare later may require medical underwriting for supplemental coverage. A woman named Denise developed a condition while enrolled. Returning became harder. Confidence gave way to worry. The reality is this: leaving is not always as simple as entering. Let me show you what many seniors experience. They assume Medicare Advantage is the same everywhere. It is not. Benefits, rules, networks, and approvals differ. Confusion builds. Energy drains. The honest truth is comparison takes effort, but it saves stress down the road. Now listen carefully. None of this means Medicare Advantage is wrong for everyone. Some seniors benefit greatly. The problem comes from choosing without full understanding. Confidence grows from asking questions. Awareness is what provides protection. Before we move to the end, remember I promised a checklist, and I want this to be the kind you can actually use in real life, not the kind that sounds good and disappears the moment you hang up the phone. So here it is, spoken calmly with real steps. First, ask whether your doctors are in network, and do not stop at the plan website directory. Provider directories can be outdated. Call the doctor's office and ask, are you currently in the network for this exact plan name, in this exact county for this exact year? And can you note it in my chart? Then call the plan and ask them to confirm it, and write down the date, the representative's name, and the reference number for the call. If your plan changes networks, your early warning sign is the Plan Annual Notice of Change, the ANOC, which is sent in September for changes that take effect in January. Read it like you would a weather report before a storm, not after. Next, ask how prior authorization works in real time. Do you need it for physical therapy, imaging like an MRI, home health, skilled nursing, or certain specialists? And here is the practical fix if you get stuck. Ask your doctor's office who submits the request, what documents are included, and what the average turnaround time is. If waiting would harm you, ask about an expedited request. If you receive a denial, do not accept a vague no over the phone. Ask for the decision in writing and ask how to appeal, because you have the right to challenge denials. Now travel. Ask, what happens if I get sick outside my service area, and what about follow-up? Emergency and urgently needed care is protected, but follow-up specialists may be out of network, which is how surprise bills happen. The prevention step is this. If you are traveling for more than a short visit, ask the plan in advance about guest visitor or travel rules, and keep the member services number saved on paper and in your phone. Then ask about yearly out-of-pocket limits and how benefits reset, because the calendar can quietly reset your costs. Ask how prescriptions are handled if they change, which pharmacies are preferred, and what happens if a drug moves tiers. Finally, ask how easy it is to leave later, because this is one of the most misunderstood parts of Medicare Advantage, and it matters more than people realize. Many seniors assume they can switch any time without consequence. In reality, there are specific enrollment periods, and leaving does not always put you back where you started. If you return to original Medicare, getting a Medicare supplement policy may require medical underwriting in many states. That means your health history can affect acceptance and cost. This is not a scare tactic. It is about timing, and timing matters. Ask the plan directly. If I decide this no longer works for me, when can I leave? What are my options? And what happens to my coverage in the meantime? Ask during open enrollment, not after a problem appears. Write the answers down. Many people only learn these limits after their health has already changed. If any of this feels overwhelming, pause. You are not expected to figure it out alone. That is where your local state health insurance assistance program comes in. SHIP counselors provide free, unbiased help. They do not sell plans. They do not earn commissions. Their role is to explain options, timelines, and consequences in plain language. They can help you compare plans, understand notices, and even walk you through appeals or enrollment steps. You can reach them through the Medicare helpline or by looking up your local SHIP office. Let us slow this down. The mental shift I want for you is simple. Convenience should never replace clarity. Medicare Advantage is not just a plan, it is a system with rules, timelines, and trade offs. When you understand that, you regain control. You are not behind, you are not difficult, you are careful, and that matters. If a situation ever feels legally or financially complex, contact a licensed attorney or qualified professional who can give you advice specific to your circumstances. You deserve calm, clarity, and respect. If this information helps you recognize a pattern or avoid a mistake, share it with friends, neighbors, or family members who may face the same decisions. Many seniors encounter these problems simply because no one explained them this way. Like and subscribe so I can continue providing information most seniors are coping with quietly. I read all comments and emails personally, so do not hesitate to reach out. Carry this forward with you. Our rights do not expire with age.